Are you having issues getting pregnant, or maybe you just don't have all the parts that you need? What is an option that you can use? IVF. Let's talk about it. IVF. What does it mean? First off, we're going to give a kind of a definition, and then I'm going to talk about what the process is like, and then we're going to talk about some cost and who is IVF for. First, I'm going to talk about what IVF is, who uses it, and then we're going to go into some discussion about what is the IVF process and a little bit about some cost involved. I'm going to make an entirely different video talking about the different costs of IVF and some of the hidden costs that you might not think of when going through IVF, because believe me, unfortunately, there's a lot of cost and there's a lot of things you don't think about. But that will be for another video. Let's get started with what is IVF. So IVF stands for in vitro fertilization. And what that means is when you take sperm, eggs, put them together, make an embryo, and then that embryo is transferred into the person who is going to be carrying the pregnancy, hopefully, and then you wait to see if you're pregnant. But there's a little bit more than just egg and sperm meet, you put it in, and there's a lot more involved. But first of all, who would be using IVF? Really, there's a variety of reasons that somebody would want to use IVF, and it's not just for people with infertility, although that is one of the main reasons that people use IVF. So one of the things is if you've already tried what are called IUIs, intrauterine insemination, which I will link up to a video here talking about what IUIs are, who uses them, the process, and all of that. So once you've done IUIs, and if they've not worked for you, then the next step is usually IVF. Sometimes that's not the case, but majority of the time, then your doctor, your RE, reproductive endocrinologist, is gonna suggest IVF. Another reason could be that you go straight to IVF, and one of the reasons you would go straight to IVF is if you know that either yourself or your partner is a carrier for a specific syndrome or disease. Sometimes people will want to avoid having that potentially as a natural pregnancy because the risk is high that their child would have such syndrome or disease, and they don't want that. So what they do is they go straight to IVF, they make embryos, they have those embryos tested, and then they can see which embryos either have or are very high risk to have that syndrome. And you can avoid using those embryos and pick the embryos that are syndrome or disease free of whatever that parent or parents have. This can be done, like I said, for many different syndromes or diseases. There are some that are just very, very severe and often would lead to miscarriage over and over again, or pretty much no life for the child. So in that sense, the parents are just trying to avoid heartache and, issues for their potential child. Another reason that someone would go straight to IVF is if you wanted to do what's called RIVF, which is reciprocal IVF. Reciprocal IVF, in brief, which I'll make another video about this just by itself, but in brief, it means that usually it's a couple, one partner is the egg donor, and so these are more medical terms, but one person, we use their eggs, and then the other person in that couple is the one that's going to carry the pregnancy. So both people are involved, but one person has the eggs and one person is the carrier, which is something that my spouse and myself did. But we'll talk about that in another video. Another reason is going back to the IUIs. So if you're not producing many eggs, IUIs might not be a good avenue for you, and they might suggest that you go straight to IVF, or you might have already tried IUIs and they're noticing that you're not producing many eggs, so therefore they might suggest that you go to IVF. And also, if you are of advanced maternal age, a geriatric pregnancy potential person, I hate those words, but if you are of older age, your egg quality might be diminished, then it's more likely that they would suggest that you go through with IVF, just because it's more likely that if you can get a a bunch of eggs, not a bunch of eggs, but if you can get a few different eggs and then try to make the embryo, it's more likely that that will work more than just trying with an IUI for only producing one egg and that egg isn't good quality. It'd be better to try IVF. Another potential reason that you would do IVF is if you have male factor infertility. So if you have male factor infertility, sometimes it's much harder, even doing IUIs, to have it be successful, because even in an IUI, the sperm has to make it up through in the uterine cavity to the egg and, fertilize the egg. So if there's male factor infertility where, let's say, you have really low motility, the sperm don't move much, or you don't have many sperm, just a low count, then that would potentially impact. So it'd be much easier to do IVF and use something that's called ICSI. It's ICSI. I'll put what the long word of what that means is right here. But what they do with ICSI is they select the best sperm and take those and actually inject them into the eggs when they're trying to fertilize to better the chance that it's going to work. So in that sense, if you don't have many sperm, or if you have motility issues or morphology issues, meaning they're bent or the tails or they're doubled, there's lots of different things. It'd be better for the embryologist to pick the better sperm and then inject those into the eggs to try to fertilize them. The last few things I'm going to mention are if you've had reoccurrent miscarriages, whether that's through natural pregnancy methods or through IUIs, then they might want to make embryos and test them before they go ahead and try another pregnancy, because if you're having a lot of issues with the quality of the embryos, then that could cause reoccurrent miscarriages. And obviously, any miscarriage is unwanted. However, if you've had reoccurrent ones, then there's a really high chance that maybe you have issues with the embryos, and it'd be better to know ahead of time and try to get a better quality embryo and try to get pregnant that way than continue through natural methods and continue to have losses. The other two are if you're going to do surrogacy. Now, most people will do IVF first, and then if IVF is not working for them, they would go to surrogacy. But for some people, they already know that they're not able to sustain a pregnancy, whether it's due to genetic reasons, if they have certain medications they're taking. Some people are born without a uterus, or they've had cancer. So there's a lot of different reasons that they know ahead of time that they're not going to be able to sustain a pregnancy. So in that sense, they would do IVF solely for the purpose of making embryos to then do surrogacy. Now, the last two reasons are a little bit more rare. One of them is if you are purposely trying for multiples, usually for twins. Most of the time when you're purposely trying for multiples or twins, that is through surrogacy. Now, again, this is not recommended anymore, and I'm going to make a video about surrogacy, and I can touch on the reasons of why they usually only prefer single embryo transfers instead of trying a double embryo transfer, which is when you're trying for twins. But for some people, if they're doing surrogacy, they may only have one shot at it because it's so expensive, and they might want to try for twins. And again, that is their decision. We can talk about that later, but that is another reason. And of course, there's always other reasons that I might have missed that someone would do IVF for. Some people just need to do IVF. There's many reasons. Those are the majority of the reasons, and that's quite a lot already, but those are most of the people who go through IVF. So now let's talk about the process of IVF. What is exactly involved? It is a very invasive process. It's a long and expensive process, but let's talk about what exactly is going to happen. The very first step when you're considering IVF is obviously to talk with an RE, a reproductive endocrinologist at a fertility clinic. And we can talk about at a later time, how do you find the right fertility clinic for you? What kind of questions should you ask for? Those sort of things. But the very first step is you're going to find a clinic and you're going to go and speak to your reproductive endocrinologist, and you're going to kind of make a game plan. For some people, it's going to be very straightforward, where they're going to say, I don't have a uterus, we need to go through IVF. And for that sense, if there's no other medical issues, then they're just going to put you on a medication cycle and they'll just go through the process, do the egg retrieval, go through surrogacy, blah, blah, blah. For other people, this is going to involve testing, potentially some invasive procedures, because again, depending on the reasons you're doing IVF, you might need to do testing as to why are IUIs not working? Why haven't I gotten pregnant yet? A lot of different things. They'll do blood tests, and they do potentially, checking your uterus and all these other things. And then let's say they find that you have a lot of scarring done. They may do a surgery for that to help get rid of some of that scarring to potentially allow you to become pregnant. So there's a lot of different things. So talk with an RE and get your testing done, a blood test, all of that. And then the RE will set up a game plan for you. Once that game plan is set up, then you will go on your medications. So they will have a specific med calendar for you, and you're going to follow that medication calendar. Most of the time, this involves taking pills and injections, sometimes patches or suppositories. It just kind of depends on your clinic and what they think is going to be best for you. So it's always going to be very individualized. There are certain medications that are used more than others, and we can talk about that at another time. Once you have started your medication cycle, you're going to have monitoring done to make sure that all of your numbers for your hormones and different things are all in a line. Make sure that, see how many eggs you're producing. They're going to want to make sure to check if you're producing enough eggs or too many eggs. If you're producing a very high volume of eggs, then they're going to adjust your medications. And then once you're getting close to the actual egg retrieval, then you're going to have the sperm sample given. So that means either a fresh sperm sample is given by a partner or whoever is going to give that, or you will have your frozen sperm sample thawed out. That is usually shipped in, obviously, beforehand. Depending on the clinic, it could be a couple days beforehand, up to a week, 2 weeks beforehand. It depends on their rules. But you will have that done, and then you will have your egg retrieval. Now, the egg retrieval is a little bit different depending on your clinic. Most clinics I know, the person getting the egg retrieval goes under general anesthesia, so they are out for the procedure. I have heard of some people saying that they did not have anesthesia for it. Can't imagine, but I've heard that. So it's a possibility. Definitely talk with your RE about if you're going to go under anesthesia. They will obviously tell you regardless, because there's certain medications and they have to make sure that you don't have any issues with anesthesia. So the day of the egg retrieval, you will come in at a certain time. Normally you'll come in more in the morning end, because you're not allowed to drink anything due to the anesthesia or eat the night before. You will come in, they will give you an IV, they will go through the process of the egg retrieval. And once the egg retrieval is done, they will tell you how many eggs they were able to get. Once they've done that, you will go home, you will recover. And depending if you're going to have a fresh transfer or a frozen transfer, it's a different process. If you're going to have a fresh transfer, then within the 5, possibly 6 days after, you will continue with the meds that you were already on for your cycle for the egg retrieval. You will continue on meds, and then you will come in on day 5 or 6, depending on your clinic, and they will have you do the transfer, depending on if you've gotten any embryos. Hopefully you did. And if you've gotten embryos, they will pick the best one, or whichever one you decide on, and then they will go ahead and do a fresh transfer. That's 5 to 6 days, because normally what will happen is they will tell you how many eggs you got on day 1, and then the next day they will, or the same day or the next day, they will tell you how many eggs have been fertilized. So once they've put the eggs and the sperm together, and then sometimes on day 3 and then on day 5, possibly day 6, they will tell you how the embryos are doing. So sometimes on day 3, they'll give you an update of this is how many embryos are still developing, still growing. And then on day 5 is usually when they give a final count. Sometimes they'll let embryos go until day 6. I've heard of day 7, but not usually. Usually it's just day 5 and day 6. So that's if you're doing a fresh. Now, if you're doing a frozen transfer, that means that same process. They will tell you how many eggs on day 1. They'll go through, they'll say how many are fertilized, blah, blah, blah. And then on day 5 or day 6, or both, they will give you the final count of embryos that you've gotten. And then whatever embryos you've gotten, they are frozen. If you're going to do a transfer relatively soon, they will freeze them. And sometimes they'll keep them on site or send them to a place that is local. And then once you are ready, you will go through the cycle of doing a frozen embryo transfer, which just means that you will start back up on medications and go through that whole process and then do the transfer. And then obviously once the transfer is done, you have a 2-week wait, you get a blood test, and they tell you if you're pregnant or not. Now, I mentioned that we were going to talk a little bit about cost. Again, I will make an entirely different video talking about what are all the cost or most of the cost involved in IVF, but I just wanted to touch a little bit on that here. Now, IVF costs range immensely. It can be anywhere from $9,000 to upwards of $30,000 per cycle. So per time that you go through the meds, do the egg transfer, and then do a transfer like that. That altogether can cost anywhere from like $9,000 to $30,000. The average is about $12,000 plus cost of medications, which medications on average could be anywhere from $1,000 to $4,000. It depends on all of the meds that you need and where you get them from. Now, I know that some people for medications, if they're just doing like a mini IVF, or they don't need as many medications, it can be down in the $1,000 range. Also, sometimes you can find certain pharmacies online that are cheaper. Just please make sure that you do your research. Don't get medications from places that are not reputable. This is very important. You are injecting medications into your body. You don't want things that are, not properly dosed or that are just not what they say they are. So please use reputable places. Now, going up to the higher end of medications, if you use a lot of medications, or some pharmacies just charge more, then you might be paying more. So medications sometimes cost quite a bit. And then again, it just depends on your clinic and what they charge for each thing. Always, if you can, check with your insurance to see if they cover any cost of IVF. For myself, we actually had quite a lot of our IVF covered when we went through and did the process, because we had like a chunk of money that they gave us for IVF, and we used every penny of that because it can be very, very expensive. But definitely check with your insurance first, and also make sure and see if there's any way that you can find discounts, or if there's like a pay in cash. Sometimes clinics will have cheaper prices if you pay in cash instead of going through your insurance. Sometimes it's cheaper. Again, I'm going to make another video about costs that'll include things like, what are the averages for certain places? What about grants? What about loans? All of those different things related to cost. So stick around to make sure that you see that video, because cost is a big factor for people. Just to end things here, I just want to say a few things. Just remember, IVF is no joke. It is a long, grueling process. A lot of emotions are involved, and it is really, really tough. Whether that's financially, physically, mentally, it can be a really tough thing. So make sure that you have the support that you need, whether that is from friends or family, or maybe even if it's just online support through Facebook groups or, on TikTok or wherever it needs to be. Make sure that you have support, even if you have a spouse or a partner, you're part of a couple, whatever you want to call it. Sometimes just having one other person, they're going through it too. And so it's nice to kind of have some outside perspective and outside support to just kind of not have to just push everything on each other. I'm not saying that you can't support each other. You definitely can, but having some other support is definitely going to help you to get through this. And make sure, like I said, it can be a lot. So make sure that you're emotionally and financially ready before you start this process. Like I said, if you're in a couple and you haven't really thought about it and figured like everything that's going to be involved, and you're not in a strong place in your relationship, this can really be rough on a relationship sometimes to go through this, because like I said, it involves a lot of emotion. So make sure you're in a good spot if you're in a relationship of any sort before you start IVF. And you can always take breaks. If you're going through IVF and you've gone through one cycle, you've gone through an egg retrieval, you don't have to do a fresh transfer right away. You can wait. If you've gone through and you did the egg retrieval, it didn't work, you need to do it again, you can take a break. If you've done one transfer, 2 transfers, whatever, and you feel like it's becoming a lot, take a break. Give your body, your mind, your soul a break. that's okay. Sometimes that's what you need to be able to go on to the next part and then eventually have that successful pregnancy. Is just taking a break. Definitely let me know what questions you all have. Like I mentioned, there are definitely going to be some videos in the future talking about cost and specifics of IVF. But if you have any other specific questions, you can leave them down below. I can answer them there. Plus, I can also make a video if it's a big enough topic and I feel that a video would be better than just answering in a comment. And yeah, if I definitely don't have the information because it's more of this is an ask your doctor question, I will let you know below, or I will find some articles or different things that will help lead you in the right direction. If you are considering IVF or if you're going through IVF, just remember, take care of yourself, and I'm sending you all my love and support. Remember to subscribe and like this video so that you can see more videos coming out, whether that's about IVF or natural conception or IUIs or surrogacy, anything that helps you to build your family. I'll see you in the next video. Bye.